There's really nothing I can say of value, I think, to you about this general issue of mentoring. Those presentations that I've heard have been wise and deep and reflected more than what was in my mind before I start. I do think it really is valuable to hear people's stories directly, because it brings up specific issues and general issues, and although we're calling this mentoring, I think we're talking really about a range of things we'd like in our lives that would help us get to where we want to get, and some of those things are barriers, and some of those things are enablers, and mentoring is one enabling matter. I think networks too. Networks are kind of support mentors, if you like. They're beyond the individual mentor, and just speaking for myself, I came out of the far bush, and also a community that never had anybody at university at the time, and so going to a university, even though it was a small one in the country in Australia, it was pretty scary, and those bunch of friends I made early on had similar backgrounds to me, were very, very important in those years. And I'm sure this is true for all of you. Your network of contacts are really very sustaining. And I was thinking about it yesterday. I've forgotten who was giving the presentation, but talked about a very diverse group of people, and that's true for me too. You know, I have, as I said yesterday, I think Vice Chancellors and Elaine and various people I get in contact to, but I still have people, at earlier stages of my life, and they're a very diverse bunch, and they've had their own life courses as well, and I don't know what I'd do without them, and some of them I don't see very often, but there's the occasional phone call or get together, and they're spread around the world now, and it's just, it feels very supportive. I'm very keen to hear what comes out of this afternoon. I'm absolutely convinced it'll be wise, because I've heard such wisdom already. I think there are probably two aspects about that. I think we have something to do as country by country about mentoring, and I'm looking forward to what the Australians say to the NHMRC, of what they want to say and what they'll say, having discussed this more broadly with people from New Zealand and Canada. But I'm sure I speak for Elaine and Robin as well, that we're really looking forward to smart ideas about how we can add value across the three countries, and what we can learn from each other across the three countries, and how we can keep the value and add to the value of the last few days. One of the things that I hope you'll keep in mind, I'm sure you will, is, how to say this, an eye on the horizon, I suppose. There are many struggles here and now, there are many barriers here and now that need to be overcome. But let's see if we can sort of have a vision for 10, 20 years ahead as part of what we need to do here and now. I'm not saying that because I don't want to do things here and now, I really do. But let's put it in the context of where we want to get to. And it always helps me to think about, so in 10 years' time or 20 years' time, what would we like to have in Indigenous health in this country and that's the bit I'm responsible for. What would it look like? Where are the people? Where are they going to come from? And what do we need to do to provide that mentoring support to get there? I'm hoping myself that and you know, call me a unrealistic optimist, and everybody does, so why shouldn't you? But you know, if when we're having this, a bit long after my time, when we're having the you know, the 10th anniversary or whatever of this meeting, that the issues have changed, and you have inspiring leaders here who are Aboriginal Australians or Torres Strait Islander Australians or Maori or whoever. And the conversation has changed. Now, you know, I'm sure some of you are going, yeah, Warwick, you know. Yeah. But that's what I hope. And I hope that in those leaders we have great clinician researchers, we have great public health and health services researchers, and we have great molecular biologists who are also Indigenous peoples as well. So we have the full range of researchers, and they're way more numerous than they are now. So good luck. Think hard. Make sure you put a bit of pressure on Elaine, Robin and me, and because we're used to it, so it's no problem. And as I said earlier, I'm sure great wisdom will come out of today, because great wisdom's already been shared over the last day and a half, and I'm looking forward to hearing what comes out of the day. So thanks a lot, and please excuse me again as I go back to the nation's capital, which is not much colder than here actually at the moment. So thank you.
Kia ora tātou, I te tuatahi, he mihi ki te tangata whenua, ki Wurundji, he mihi. He mihi ki te kaimahi o Rangahau Hauora, o Aotearoa, Australia, Canada. He mihi kia koutou katoa. Thank you for this opportunity to speak today around this really important issue. And everybody yesterday and this morning have said my whole presentation really, so I'll be repeating some of those things now. I was also, some people have mentioned they were thinking about, you know, what am I doing? What am I presenting? And I was having that issue myself about what am I supposed to be presenting? So this is what I thought I was supposed to be presenting. So I just want to go through a program of research which was funded, thankfully, by the Health Research Council in New Zealand, which we're involved. Te Ata is the host of this program of research. And I just wanted to introduce the team just very quickly. This is New Zealand. The top part is the North Island and the bottom part is the South Island, if you weren't sure. The team for this program of research is myself and Dr. Cheryl Smith from Te Ata which is an independent kaupapa Māori community-based research organisation. We also have Dr. Leonie Pihama, who also has her own independent kaupapa Māori research institute. She has also shifted now to Waikato University with Professor Linda Smith and part of her research institute which she set up recently. We also have Professor Linda Smith herself, who's on the program team from the University of Waikato and the writer of Decolonising Methodologies, and it's a real privilege. Dr. John Reid from Te Runanga o Ngaitahu, and Emma has mentioned she was working at Te Runga and still is Te Runanga o Ngaitahu, and Emma also was working with us earlier on in the project, on the program. We also have a whole host of community researchers from around the country that we've worked with over the years on different projects, all Māori, all based within their own local communities, and they are the ones who talk to their own people around our project areas, around the subjects that we have for research. We also are very fortunate to have Professor Karina Walters working on our program, and also Dr. Eduardo Duran, who are, in relation to this topic, experts, Indigenous experts around historical trauma and intergenerational trauma. So we're very privileged to have them on the team and involved with this work. And also Tākiri Rangi Smith as an advisor, and we also have a number of other advisors from within the country who are all really important in the running of this program, the successful running of this program. Why I showed you that chart, the research team, is that Indigenous research is led by a CIA or PI, a principal investigator, should be led by an Indigenous principal investigator or CIA. All the projects involved within our program are led by Indigenous researchers, are led by Māori PIs, and the majority of our research team is made up of Māori. And that's an important point, and that's a basic point, basically, for any Indigenous research. It needs to be led in terms of a program overall, and also in terms of individual projects, and also in terms of project teams. So that's a basic. And this has taken a wee while to get here. I've been involved with the Health Research Council committees as well as a Māori Health Committee member, as is Amohia and Rachel, who's fantastic in the Health Research Council, which is not a very positive or not a very warming role to be in a Health Research Council which is made up pretty much of biomedical researchers, and that's where the powerhouse is, biomedical research. That's what the Health Research Council in particular will set up for, not for Indigenous research. So there's been a whole lot of activism, there's been a whole lot of working towards getting space, and other people have mentioned it before, getting space for Māori researchers. And it's not been easy, it's been hard. But this is one space, the Health Research Council, and many other spaces all around the country, in government departments, government agencies and universities, in wānanga, which are tribal universities around the country. We're pretty lucky, we're pretty active, and we're pretty loud. In our projects, this is just a given also. All of our community researchers, as I said, are Māori, and they come from their own local communities, and they are the best people to talk to their own people within their own communities around research projects that we get funded for. We have research teams which are made up pretty much of our mates, others we know, and others we've worked with before, and others we trust, and others we know are on the same kaupapa or have the same values, the same beliefs, the same philosophies, the same starting places. And that's extremely important, because you cannot join up with a research team and do a collaborative research project if you don't know them, if you do not know that other team. And it takes a long time to establish those relationships. We also have advisory boards. And again, with the advisory boards, we also have our mates, who are also researchers, who are also professors, who are also doctors, who are also have key roles within communities and within all of our different Māori organisations, which is extremely important in giving us advice and giving us guidance and also hearing out some of the ideas we have. Now, don't be scared by this. This was put in for a research application to get our program funded, and basically you've got to talk to the assessors in those committees to get your research funding approved. This was showing the capacity that we could create by getting our program funded. So on all sorts of different levels, from students, from postdocs, from research assistants, from community researchers, from international collaborations, from national collaborations, this was the impact that our program, and I'm sorry, I'm not being knobby or anything about saying, you know, this is the best program in the world kind of thing. That's not what I'm saying here. What I'm saying is this is how we worked the system. This is how we showed that we can do what we said we can do, and we will have an impact. So this is the impact on our workforce we put down. Now this is a limited, basically this is the minimum of what we could do. we're far doing more than that. And we always do that. We always do more, and we always do it with less. Some of the things coming out of that around the program is research capacity in a number of different areas. So, for example, it goes right across the spectrum, not only in academia, but also within our communities and also across all disciplines, as people have mentioned before in this room. So it's about mentoring, it's about supporting, it's about nurturing, it's about encouraging, it's about giving praise, it's about celebrating. I think Dr. Wilson mentioned yesterday. It's about all of those things. We are out there, we are doing good work, and we're doing valuable and important work. But we need support, as lots of people have said, at all different levels. So in the community level, as I mentioned, we've got over 30 plus, and probably more now, community researchers around the country who we employ in their home communities. And we re-engage them because we've already established a relationship with them. We re-engage them again because we know what they're like, we know what their philosophies are and their values are, and we know that they are similar. We train them, and then they go home and they train others. They train their own. And in some different tribal areas and some communities, they have their own tribal research units as well, which have been established. And those are extremely important for their own local, important issues for them. Other things that we've done, in particular around the program of research, is bringing across international experts, Professor Karina Walters and Dr. Eduardo Duran, to talk about historical trauma and intergenerational trauma and healing to our own communities. So going around our communities and talking this stuff and making the links with how does this impact on Māori culture, how does this impact on Māori communities, what's the link? Is there a link? And there is a link. Research team training, there's all sorts of things that are happening within our research team. We're very lucky to have a number of expertise or different expertise within our research teams. And from professor level, senior kaupapa Māori researcher level, mid-career level researchers, junior researchers, community researchers. And we're all learning. We're all learning and supporting one another. And we're sharing that knowledge and sharing that learning. Another thing is, within the pool of expertise within this program of research, we're able to pick up some of that expertise to train us, other senior researchers, about stuff. So, for example, Professor Karina Walters was talking to us around methods, gave the program leaders a workshop around methods, quantitative research methods, and in particular, looking at interviews and data we were going to collect in prison, because we're interviewing around 100 Māori men and women in prison, around sexual violence area, and around talking to our own communities around land dislocation and wellness. We've also got visiting fellows. This is way before the program. We've been doing this for a long time. We have Indigenous scholars coming to visit us all the time, and we host them and we share what knowledge we have, they share what knowledge they have with us, and we have combined learnings together. They can be official, they can be public training sessions and that, or they're just informal community gatherings and cups of teas with our kaumātua queer, with our elders, and with different community groups. But all of those meetings and all of those engagements are important for sharing knowledge between countries, between Indigenous peoples, and between researchers. Other things that are really helpful, and people have already mentioned that as well, within the program, we put in that we wanted specific funding to support Māori postgraduate study. We also wanted specific support around writing, support for writing fellowships, or fellowships to support writing. There's an acknowledgement within the team, when we were putting that program application together, that our own senior academics don't have time to write. And people have also mentioned the reasons why yesterday and today. Whānau, family, children, 5. I've got 3, 1 living with me. And our roles and responsibilities as community members, as tribal members, as sub-tribal members, those kinds of responsibilities, as well as academic responsibilities, and if you're running an independent research institute, responsibility to find funding to keep the workforce that you do have, which you've trained over a number of years, to keep them on, which is difficult because you've got to be doing research, but you've also got to be scouting for funding at the same time, which takes a long time. And for some of these projects that we've actually put in proposals for, they've been in germination, for 3 years or more over time and building relationships. So it's not short, bang, let's put in a proposal. It's a whole lot of time spent in thinking, looking through different issues, talking to different experts and so on. We also find ourselves being asked to be mentors and advisors for a number of Māori students from around the country. And that's just a given. As people have mentioned as well, you get approached, or people put your name forward. Students have been advised to go and see this person because they'll be good to help or whatever. So that happens naturally, and we do that naturally. We don't actually have a support fund for that or anything. We just do it because you have to do it, basically. Yeah, who else is going to do it? And everybody else does within our Māori research communities, and I know within the Indigenous research communities too. We have to be there to help, we have to be there to support, to bring up others. As Associate Professor Noel has mentioned also in his sort of pioneering role in Indigenous, bringing through other Indigenous researchers. And it's lonely sometimes, and they need support. I know for our own, they need support too, but we all need support in doing our jobs, which are enormous sometimes. Other thing is we're hosting a cohort of local postgraduate students. So within our own communities, there's PhD, there's master's students, there's bachelor's students living within our own communities, but are often isolated, attached to different institutions or sometimes the same institution, but don't have opportunities to get together. So Meta mentioned the MY program. So it's similar to the MY program, but actually more ad hoc, just pulling together those who are in postgraduate studies or other studies to do work and network together. And Te Whare Wānanga o Awanui Ārangi has been really, really proactive in supporting Māori postgraduates in particular. This is another one. This is something we all know, and people have spoken about this too. It's about knowing the funding system. And the first point is a simple one as well. The system basically wasn't set up to fund Indigenous researchers. As I mentioned, the Health Research Council was set up pretty much to fund biomedical researchers. Biomedical researchers hold the table within the Health Research Council. The majority of the funding goes to biomedical researchers. But who are the PIs and the CIAs on biomedical research which impacts on Māori health? Not Māori. So that's a real issue which I have and which the Health Research Council has around getting more Māori as PIs and CIAs in different projects and in different programs. In relation to programs of research supported by the Health Research Council, over 20 years there's only been 2 programs that have been led and run by Māori researchers over those 20 years. That's huge, huge investment over 20 years gone into programs, and there would be at least 3, 4, 5 programs invested in each year worth about $5 million each. So there's bulk money going into those programs that are researching Indigenous or Māori people, but not working with Māori researchers themselves to help our own people. So what I encourage is everybody's got to get in there and encourage others, newbies and all, emerging researchers, to get on these committees, become assessors, become reviewers, become everything and learn the system. That's basically what we've had to do, is get in there and learn the systems. Because currently the systems aren't changing. Some are changing, but not fast enough. For example, for Māori health research, we get a small percentage. I think it's slightly higher than some of the other percentages of the total research funding pool than I saw some other countries were getting. But, you know, relatively, very small, very small. Okay, so there is an art in writing applications and proposals also. That's a big, big art that, you know, you've got to use the right language, you've got to use the right combinations of teams, you've got to put in the right expertise, you've got to have the track record, you've got to have the publications and so on and so on. A lot of Indigenous researchers don't have the track record, don't have the publications, because they're too busy looking after their families, looking after their tribal responsibilities and all sorts of different committees, looking after other Indigenous research students. Too busy doing all sorts of things. And I just want to finish with this one is, as I mentioned, is in any program, in any projects, relationships are critical and they're not finite, they're ongoing. You don't go into communities and then come out of, you know, I'm preaching, you know, you all know this kind of stuff. But the same with program development. It doesn't happen like that. It takes years of getting to know different research teams and people you're willing to work with and people you know who have the same kaupapa as you. Because it's a huge investment and it's a huge engagement and it is a huge relationship in trying to do good for our people, our combined people as Indigenous peoples. We're trying to bring about positive change. We're trying to bring about improvements in our own health and well-being. We're trying to do that. That's a big job. So we all got to work together. So that's why I've said it takes quite a few years to build those relationships, to get a good program together, and to establish the protocols. I think I've heard some people say about how we work well together. And I'm finished. And that's my kids down there. That's my boy on the left. That's Lewis. He's my whāngai son, my foster boy. And then these are my babies, my twins here, Te Ahuru up the top there, and Matariki hanging around my neck. And this is their sister, and their sister is a sister to Mera, who was speaking before, her daughter. So there's lots of combinations and there's lots of whānau relationships. So kia ora tātou, he mihi kia koutou katoa.
Thank you for the opportunity. I feel a bit of pressure because I'm the thing between you and a biology break, and probably some people are wanting that about now. Yeah, so this symbol down at the bottom is really the artwork that determines or defines our center at the University of Victoria, and you'll notice that it has the face of a wolf. But it also has, if you look at it differently, the face of two wolves facing each other. And it was meant to symbolize the notion that that sort of two-eyed seeing idea, to take the best of Western science, but also to have it the best of Indigenous science as well, and to merge that into things that will be useful to improve the health of Indigenous people around the world and also where we live. I wanted to show you a little bit different view of the world. I think we need to actually recognize that all these boundaries are completely artificial, that Indigenous people don't need to limit themselves to geographic boundaries that were created by dominant societies that actually alienated our cultures, and that we actually should think of ourselves as being able to wander the world and do what we want, because this is our planet and we live here. And in that sense, everyone is Indigenous, but you know, we do have to recognize that we are limited in these geographic and social boundaries and the economic conditions that are there, but we need to actually look at ways of overcoming those limitations. So just quickly, I guess we're at the point of the meeting where we have to start thinking about what are the common elements that we can actually draw upon. What might be core elements that are sort of things that we can agree by consensus that we want to move forward, and what are some of the unique elements that would be in regions, in communities and within each country that don't necessarily need to be agreed upon among all three countries, but that we actually make sure that it's robust enough that we have the flexibility to respect the unique differences that we've heard about. The idea here, I'd like to just talk about a program example from the United States, which is the National Institutes of Health, Minority Health and Health Disparities International Research Training Program, which I think has some interesting elements. And just a picture of where I work, where I'll be going home to on Sunday after spending some time here in Australia. This is the University of Victoria. We have 18 Indigenous faculty members. There are 600 undergraduate students, 150 graduate students, and we have a First Peoples House on campus where we hold many events, including we just had our 3rd annual Summer Institute there. And I've had the chance to work for the Baker Institute for Heart and Diabetes Research here in Australia. It's a world-class kind of biomedical clinical research institution that's been operating in Australia for over 100 years. And on the other side, that's the staff up at Alice Springs in Central Australia in the Northern Territory. And of course, many of you from Australia will know that this was Alex Brown's initiative, and Alex has since moved to bigger and the brighter lights of Adelaide, where he can work at the SAMRI. But you know, there is a really robust and well-funded sort of research enterprise in Indigenous health here in Australia and also New Zealand and Canada. So I just wanted to reflect on some of the things that I heard over the course of our time together. And you know, really these opportunities involve multifaceted domains of interest that can be described as interconnected themes common to each of our nations. And that includes, but is not limited to, community-engaged health research priorities and processes, broadly envisioned. And that's something that we all, I think, can agree as this community engagement focus. Obviously, we have a big issue around healthcare systems, health services, and the policies creating culturally safe environments in the healthcare delivery system. We're also very interested, all of us, in this notion of capacity building, which is really about succession planning and also creating capacities within our communities to be consumers and producers of their own research. Translating research evidence into public policy is critical, because without that knowledge getting translated into programs, it's not useful. It doesn't address the long-term goal of improving health. We've also talked about this clinician researcher mentorship and patient-oriented care, which I think is extremely important. It's important from the physician, the nurse practitioner, other allied healthcare providers. And then this other notion of open topics, you know, having the flexibility to actually be very creative, working with our communities, putting forward ideas that are out of the box. They're curiosity-driven, culturally informed, but they are initiated by proposal, and then putting the right peer review panel together that can actually review those kinds of projects with some sort of knowledge and background. So what did the literature say? And I was looking at some of that earlier this morning. I just want to, this is really about academic medicine, and I think it's the closest I could find to what we're thinking about, but I'll just quote this. Successful mentoring requires commitment and interpersonal skills of the mentor and the mentee, but also a facilitating environment at the academic medicine institution. So it's about connecting the skills of the applicant, the environment, and the capacities of the people there. Mentoring is perceived as an important part of academic medicine, but the evidence to support the perception is not strong. Practical recommendations on mentoring in medicine that are evidence-based will require studies using more rigorous methods, addressing contextual issues, and using cross-disciplinary approaches. And I think that argues for whatever we come out of this in terms of a program needs to have a strong evaluation component so that we can actually defend the program in future years. And the third point here that came out of the literature says 3 themes emerged. Both role modeling and mentoring are valued, but were seen as different. Respondents preferred strategic interaction over longitudinal mentoring experiences. And interestingly, emotional and psychological support were considered the most valued type of intervention activity, which I was surprised when I read that, but actually I'm not surprised when I actually think about it a bit more and the experiences that I've had, mentoring other students. So you won't find this anywhere. I made it up at about 3 o'clock in the morning, and it's a trajectory, and you'll notice that the small little ball at the bottom there is advancing knowledge, and our knowledge, the evidence alone, in isolation doesn't get to our goal of improved health and well-being. It has to be connected to capacity building, and that has to be invested. It has to be connected to informed decision making. It has to result in health impacts that are evidence-based from the research that we do, and then it has to inform the much broader social and economic impacts, like around addressing poverty, health disparities, all those upstream variables that we know about. So our work is strategic by nature. It is actually the fuel that initiates all these other activities downstream. So we have to be cognizant of the fact that research is not in isolation. And this is the whole sort of research to policy paradigm. So I was looking at the CIHR website, actually. They did the international review, and this is listing the numbers of publications, the relative citations, and the publication index. And I don't really want to go through all these things here, except to say that Australia, Canada, and New Zealand are world leaders in Indigenous health research. And I put in brackets beside each of the countries there around the publications, the estimate of the population in each of our countries, like the whole population. And if you were to do the rough calculations, you would show that New Zealand is actually number 1, Australia is number 2, Canada is number 3 because of the relative population. And that's actually reflected in the third thing, the specialization index. You see that number there with New Zealand, 7.2. It's showing that within the country's priorities, they've made Indigenous health research a big priority within that country, and we have actually done that. And I think one of the things that we need to inform the health research councils in our respective countries is that, given our size, we are not going to be the leaders in neuroscience, in cancer, in heart disease, but we are already the world leaders in Indigenous health research, and that ought to be celebrated as something that we have actually achieved. So, speaking of leaders, the National Institutes of Health, with their multi-billions of dollars and everything like that, they have come up with an interesting program in the Minority Health and Health Disparities International Research Training Program. I do want to actually go through those points there because I think they're important. It says, in general, academic institutions sponsor this in an effort to broaden the scientific research experience of students, ensure that their participants receive training in experimental research design that provides for the analyzing and interpreting of data, conducting linguistic, ethics, and other training pertinent to the professional's engagement in scientific and public health research, the opportunity to present written and/or oral presentation at scientific conferences and share the results with the community, encouragement and mentoring during the remainder of their academic years, leading to the completion of the degree requirements and possibly pursuit of a career in disparities health research. And we could say Aboriginal or Indigenous health research. And it does also mention that they have a 12-week kind of summer type of institute, but they also have a longer term, a whole year type of engagement. And I think these are some of the things that we have to think about. Like, these are a menu of items that we can choose from, and we have to decide what to take forward as proposals and recommendations to the Health Research Council. We really need to mention the Native American Research Centers of Health that are the NARCH centers, which are the American analog to the NEAR centers that were created by CIHR in Canada. And actually, when we created the NEAR centers, we brought the people from the NIH to discuss how it was done in the NIH. And it's really important because they've created that kind of infrastructure and capacity in the United States. And I think it's really inappropriate that we're not actually have our Native American colleagues at this meeting. But, you know, I guess they're okay. They're doing all right. They've got a fair amount of money, big part of the pie there. So this is a really important slide, I think, because it gets down to the nitty-gritty. We're talking about financing the core elements and then thinking about some of the other things that are not core but would be other things that we could imagine within each country. So if you look across the top, we have those practical issues of the stipends for food and accommodation and tuition, then the travel for the host site, the orientation, the sharing and workshops that we can imagine, and then the other training related expenses and equipment that inevitably accompany big programs like this. And then if you look along the side, I just put my own ideas down there and it needs to be shaped better, but I think we need to focus on trainees, postdocs, and new investigators to give them that helping hand to get into their first tenure stream job, their first big operating grant, so that they can actually be successful. So I think that would be very useful. Mentorship personnel in the environment where the mentorship takes place. In this case, I'm talking about the host program. In other words, if it's an academic institution or it's a hospital or it's a community-based research center, they need to actually pony up some resources. Even if those are in-kind contributions of office space or whatever, there needs to be some commitment because those host organizations are going to be benefiting from this. I guess the guest program administration, there are administrative fees in terms of administering programs across this whole spectrum, and I think we need to think about what those would involve. And the final part, I think, is also important. Having worked for the CIHR and having been involved with NHMRC and HRC, is the National Health Research Council exchange program for the officials who actually work behind the scenes to make these kinds of things happen. And I think they need to actually see the kinds of exciting things that are going on behind the scenes, the inner workings of the peer review panels, how RFAs get created, some of the funding challenges that occur in other nation states, and some of those things. I mean, some of the things that go on that you hear about are very useful, and the knowledge is very useful in terms of your own struggle to get resources. So I guess these are some of the questions I didn't want to answer. I didn't want to put down recommendation, but the question is, for discussion and decision, how do countries want to develop mentorship? Will it be a proposal-driven process initiated by the applicant? Some of those things, I've mentored international students, and I get Fulbrights, and I get people from Mexico and South America, and they actually come with their funding package already, and I just agree to accept them, and they work with me, and that's the way that works. I don't think we want to do that, but I think we need a little bit more support and coordination. The second one is host mentor-driven application processes. I think this is an interesting idea, but if we pursue that, what is the commitment of the host institution and the mentor? I think we have to have almost like a contract so that they're actually committed to make sure that when this student or this young trainee goes to that environment, that they will be supported. I guess the critical research approach could be an a priori kind of list of topics, suicide prevention, chronic disease, infectious disease, HIV, we all know the list. We could actually do a targeted intervention that's creating opportunities for capacity building within environments that are actually research-specific domains, or we could actually have it wide open and see what comes out. I guess the other question is, what's the time frame and deliverable? Are we talking about 1 year with support? Are we talking about a phased approach where there's ongoing support? Or are we talking about a discrete, shorter period of time? And the other critical question is, we've all been on the receiving end of bad reviews. In Indigenous health, it's really bad when people don't really get what we're talking about, and that happens all the time. So we have to be very careful and give recommendations about who's going to be sitting on the peer review panel that's going to evaluate these proposals. And we should recognize that, we're going to get applications from non-Indigenous people. Probably more than Indigenous people, because people are, it's sexy, it's interesting, it's exotic, let's do it. So the final slide is, I don't know if this slide is real, and I actually don't care, but it's either at the southern pole or the northern pole. I'm not really sure, but it kind of looks like the southern because it has mountains. There's the sun and the moon and the stars aligning. And I think what we've done over the time we spent together, there is an alignment. We're all thinking the same way. We can actually make change come about. So let's dream big. Thank you.